This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital, UnityPoint Health. This week we'll give an update on the status of COVID in the community, some new information on vaccines, and we'll finish up the podcast with a question and an answer, hopefully a satisfactory answer to a mailbag question regarding COVID-19. The poet T.S. Eliot said, "April is the cruelest month, breeding lilacs out of dead land and mixing memory and desire, stirring dull roots with spring rains." And that is the truth. We've just had crummy, rainy weather, always overcast, and so we're hoping for some spring weather to start coming, as that may help, again, drive the COVID numbers in the community down even further. The COVID census in the hospital, both hospitals, I talked to my colleague, Dr. Meyer. He has one that's awaiting discharge, and we have three and no patients in the intensive care unit. Our positivity rate for testing is 3.6%. Now that is 6 positive tests out of 165 that were completed. This will have an impact on masking as the community level, which is low in Linn County. I think non-healthcare facilities will not be required to wear masks, but in healthcare we're not exempt. And there's some confusion, particularly in our UnityPoint Health ambulatory clinics, where patients believe they don't need to wear a mask per CDC guidelines, but in the fine print, if you will, of that CDC guidance is the caveat that healthcare facilities, hospitals, clinics, nursing homes are not exempt and masking is still required. The rate of transmission is 0.6, so it's under 1, so that's good. That means so for every person that gets COVID, 0.6 persons get it, so that's a transmission rate that's very low. We've been up to over 3, which that's so for every one person that gets it, 3 people get it. So that's very happy with the less than 1. The wastewater report, final one came out today. That's 3 weeks post spring break, and I do not think we'll see a bump. I get asked that question quite a bit. One thing that we are low on is monoclonal antibodies, and that's because of recent, the CDC has noted that the sensitivity or the effectiveness of the Omicron versus the Omicron variant is not as efficacious as should be. They've revoked the EUA on sotrivimab, and so now we only have one monoclonal antibody that's in quite a short supply. But other supplies in pharmacy, we're doing fine when it comes to COVID-19. Natural immunity is gaining some steam and being looked at, and I think more will come, because now that we've been in the pandemic a couple of years, we have years worth of data to look at and make determinations. So from that standpoint, I'm very excited with that, because I would like to know whether or not it has the same natural immunity as SARS-1, which is up to 17 years in cases that they followed. Hospitalizations are down dramatically, but the number of patients hospitalized that were vaccinated is right 50-50, so it's almost the same as unvaccinated. That's a change from the beginning of the pandemic, or of recent, towards the end of last year. So what that indicates, and studies are showing this, that the vaccines prevent death and severe illness, but not necessarily hospitalization. Now, I have not participated in the new program. There's the Test and Treat program, where you can get tested, and it appears from reading the CDC website that you can go on there and request a medication. The Paxlovid, which is the antiviral, it's taken for 5 days duration, started within 5 days duration, started within X number of days of symptoms or positive test, is available at 3 pharmacies. Hy-Vee drugstore, or as locals will refer to it, Drug Town on Blair's Ferry, Clark's Pharmacy down on 42nd, I believe, and then Mercy's Medical Center's outpatient pharmacy. Those are the only 3 locations that you can get that. I do not know what the cost is. I have not talked to the clinician that has prescribed that medication, but more to come on that. In regards to the BA.2 subvariant of Omicron, It is 55% of the cases in the United States and rising rather quickly, and I think we'll get up to that 100% quite soon. News this week, or end of last week, boosters recommended for, which would be equivalent of a fourth dose with the messenger RNA, are recommended for individuals with high risk, and that would be patients that have had perhaps a serious infection of COVID previously, have had active treatment for a cancer, organ transplant, and some sort of immunocompromised condition that prevents them from fighting off infection, like they receive medications for rheumatoid arthritis or inflammatory bowel disease. Those individuals should receive the fourth dose. I've had questions, Dr. Arnold, should I get a fourth dose? And I kind of talk through them, the risk and the benefits. Definitely the benefit is very high for those patients I mentioned that are immunocompromised or have a poor immune system. And the benefit's less with the patients that have healthy immune systems, so that therein lies the decision the patient has to make. I found of interest, but it doesn't really surprise me, J&J and a messenger RNA vaccine, if given together, have more effectiveness. And I believe that is from just working on different parts of the virus, just similar to natural immunity. There's a greater degree of effectiveness. Well, to finish up the podcast today, let's go to our mailbag question. And this is from Jake, and he asks, the VAERS, what is VAERS, and what is the validity of the information in that? VAERS is Vaccine Adverse Effect Reporting System, which I candidly admitted that I didn't even know existed prior to the pandemic. And I would bet money that other physicians probably don't as well. But it's a voluntary system that anyone can report into: patients, drug companies, physicians, pharmacists, patient advocates, to report vaccine adverse effects. And so it is designed to perhaps as a screening tool to pick up on something that needs to be further investigated. I think some things are coming out of that are further investigated and are proven not to be associated with the vaccine, and then other things are. And so when people say, well, there's been so many adverse effects reported, I think that's the visibility of the program that wasn't present prior to the pandemic, that just there's more data points to review. But it's a good system from a standpoint. It's a screening tool, so you want to pick up false positives and then work through that to see if it's a true relationship with the vaccine. Great question. That's it for the COVID-19 update. We're back as you can see, we're back in the studio. Glad to be back in the studio. We need to come up with a name for the studio, like Studio 54 or something like that. Thank you for listening to the COVID-19 update. For the latest on COVID-19 vaccine information and more, visit UnityPoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.